السلام عليكم.
वालेकुम अस्सलाम सर वरहमतुल्लाहि वबरकातुह।
وعليكم السلام.
وعليكم السلام ورحمة الله وبركاته.
عليكم السلام. وعليكم السلام sir.
Okay, guys, today inshallah we will try to finish all procedures, ACG and ABG teaching as well. So for practice we have Ozair, Shwaria, Afshan, May, Kashif, Shahati, Nelly, Yara, Naveed, Zishan, Imran, Farzin, Muhammad, and Rodra. Okay, if anyone interested to practice at any time, you can raise your hand. So procedures, 2 stations in the exam, and supervise and teach 2 stations. The most important domain, clinical reasoning, decision making, communication skills, and organization prioritization. So management plan, your attitude inside the room, you should be organized. Inshallah, next session will be system and joint examination. After that, communication, and then mock exams. Accuracy is the most important domain, means the general checklist. It means you should mention all the points in the checklist. Skillfulness, you should be fluent. Supportiveness, rapport, empathy, sympathy, check comfortability, pain, involve the actor, share the decision, pausing, give information in pieces, like that. Efficiency structure, you should be organized. Safety, good and correct management plan. So as we mentioned in the beginning of procedures, the general approach of teaching. Good morning, I am blah, 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 blah. May I know your name and age, if patient, or may I know your name and the grade if medical field, junior nurse or junior doctor. So in teaching, you will ask 2 questions. How much do you know so far about this topic? And anything specific you want to know. So again, from the beginning, I'm Dr. Blah, blah, blah. May I know your name and the grade? Nice to meet you, Robert. I believe you have something to discuss with me regarding blah, blah, blah. Nice topic. How much do you know so far about this topic? Anything specific you want to know? Okay. I will set learning objectives for you. Today, I will teach you and mention the topic, blah, blah, blah. I will teach you indications, contraindications, complications, how to prevent and treat complications, preparation, procedure, post-procedure management, advice and follow-up, and documentation. Okay. Don't forget preparation. Preparation means preparation of the doctor, means wash hands or PPE. Preparation of the patient means the position and the preparation of the area also. Procedure itself. So preparation means preparation of the doctor, preparation of the patient, and between the doctor and the patient means preparation of equipment. Okay, first one, Ozair.
Yes, Dr. Anil. Assalamu alaikum.
Alaikum salam, how are you? So, bear the block, we are talking about intravenous injection of anesthesia. Okay, so you will put a double cuff on the arm, and then you will insert the 2 IV access. The patient should be monitored. You will give the patient some oxygen, some fluids, and you will monitor. You will give injection in the same limb with cuff, double cuff. You will inflate You will inflate to how much?
100 millimercury more than systolic or 300.
Okay, so minimum 20 minutes,
300.
40 minutes. Okay, and you will do the reduction after numbing the area. So if the patient is not feeling the area in reduction. So for example, the patient has distal fracture. So you will wait until you find the patient is not feeling the hand, right?
Right.
Okay. After that, you will do reduction, and then after reduction, you will repeat the X-ray, and then you will remove uh, the cuff. It will be after 40 minutes. Okay. So you have 30 seconds and then 60 minutes.
Okay. Hi, I'm Dr. Uzeri, the registrar. May I know your name and grade, please? Nice to meet you. I believe you have something to discuss with me regarding Beers block. Is that right? Okay, nice topic. I set your learning objectives. Today I will teach you indications, contraindications, complications, and the precautions of the Beers block. And also I have to mention about preparation, procedure, and post-procedure management and advice. At the end of our session, I will give you some good websites and videos to teach you more. If you have any question at any point, please don't. You can ask me at any time. First, indications of the Beers block. Do you know the indications? The indication is the reduction of the wrist fractures. And contraindications. Contraindications is the hypertension, infection of the area, and vascular disease, and methemoglobinemia and lymphedema. For complication, for nausea, vomiting, tremor, apnea, coma, muscle twitching, hypotension and circulatory collapse and arrhythmia. How to avoid these complications? You have to monitorize the patient in a room, monitored area, and you have to use ultrasound guidance. You can also calculate the exact doses. Okay. And for the preparation, you have to prepare equipment. For Beers block, you need a double tourniquet cuff and piroxicam for a procedure. And also you need two syringes and also two large bore IV cannula and sterile drape and sheet. For patient position, you have to position the patient in semi-recumbent position, and you have to wash your hands and wear PPE and take consent from the patient. For the procedure, you have to do elevate the injured arm first, at least 3 minutes for exsanguinate. Then after this, you have to apply the double cuff tourniquet, first proximal, then distal, and you inflate the double cuff tourniquet at least 300 millimercury or at least 100 millimercury higher than the systolic blood pressure. And after this, check the absence of the radial pulse and inject 0.5% prolactin. And keep the cuff inflated at least 20 minutes and do the reduction after numbness. And at maximum, you have to inflate the cuff maximum 45 minutes. And you have to observe patient after the procedure at least 30 minutes. Okay. After you do the procedure, you do the reduction, you have to check reduction succeeded for X-ray, and then you deflate the cuff at least 20 minutes later, and you observe patient and document what you do. Do you have any questions? Do you understand how to do procedure? Okay, thank you.
Okay, thank you, Ozer. You still have 1 minute, 20 seconds. So what do you think, guys? How many marks will give Ozer?
He forgot the pass the cannula on the opposite arm.
Okay, so how many marks you will give?
8, sir.
8, sir.
Why?
Actually, sir, he did not check the cuff for leaking. First, he
Yeah.
should connect without connecting to the monitor without connecting to the patient to check for any leak. After that, he should go to connect with the patient, sir. If I'm right or wrong.
Okay, what else?
The dose should be mentioned this predocane 6 milligram per kg. And
How much is the dose? Did you mention the dose, Ozer?
No,
No.
Dr. Anna,
It means you are not safe, doctor.
you are right.
Okay,
He is
so
the first doctor today.
okay, so here regarding accuracy, did you ask the junior doctor or the junior nurse how much do you know so far about this topic?
Oh, I forget.
Okay, did you ask anything specific you want to know?
I forget also.
Yes. So what if the junior doctor know all learning objectives? For example, you will teach indication, maybe the junior doctor knows that, right? Maybe he knows the contraindication. Maybe he know everything except the dose. And maybe he wants only to know the dose. Clear?
Clear.
So in the Royal College want what? If you will work in the UK and can you hear me, guys?
your voice sometimes
Yes.
distorting.
Sometimes your sound distorted, Dr. Anna.
Okay, wait, please. I will check. Can you hear me now?
Yes.
Clear.
Okay. So in the exam, they are testing your skills because if you will work in the UK, you will teach junior doctors, for example, no need to teach them anything known. For example, if the junior doctor know information and you will give him the same information, no benefits. So the most important, how much do you know so far? Why we ask this question? To know the baseline of the knowledge of the actor. Clear?
Yes, clear.
you should understand the baseline. Okay. For example, he said, I know the indication and the contraindication, and I know the complication. So you will start from this point. Clear? Okay.
Yes,
Anything
clear.
specific? Anything specific you want to know? Maybe he will tell you, I want to know the procedure, how to do, and I want to know the complication. So you will teach him only these points. But if he said nothing specific, it means you will put learning objectives for him. Clear?
Clear.
Yes. So maybe the actor will put learning objectives and you will teach him, or maybe you will put learning objectives. So you have to ask him first if he can set the learning objectives for himself, or you will set learning objectives for him. Clear, guys, this point?
Yes,
Yes.
doctor.
Yes,
Yes.
sir.
Okay. So this is the first point. And you started doing the learning objectives. You started by indications. You give him much information. I think you collected all indications in the world
Yes.
and all contraindications. No, not good. Try to make maximum 2 to 3 indications, 2 to 3 contraindications, 2 to 3 complications, more than enough. But you collected everything. You are confusing your colleagues in the session. Okay, so no need to mention all details. Clear?
Clear. Got it.
Okay, so the dose here very, very important. So as we mentioned, lidocaine will be 3 milligram per kilogram, and buvocaine 2 milligram per kilogram, and brelocaine it will be 6
6 million.
milligram per kilogram. Okay, maximum dose. So here you have 2 cuff. One to check the blood pressure, and double cuff to what is the function here for this cuff?
If one of them is after 20 minutes, deflate one of them and inflate the other.
Both of them to prevent leaking of the IV brelocaine to reach the circulation, right?
Right.
So you have one cuff in the other arm, in the affected arm, or in the normal arm?
Normal arm.
Normal.
Normal arm, okay, to check the blood pressure, and IV access in the normal arm. Why? To give in fluids and to give intralipid in case the patient has toxicity. Did you mention that?
No.
No.
You are unsafe, doctor. Then you will put double cuff for birth block. Okay, so this one will prevent leaking of the IV prolocaine from the affected arm to reach the circulation. And why double? To be sure there is no leaking. Clear now?
Yes.
Okay. So otherwise, I think you did very well. I'm just optimizing your approach. So I will give you 7 marks, okay?
Thank you. And Dr. Ani, can I ask one thing?
Okay.
What is the started dose of pirolocaine in the Beers block?
Yes, you will give maximum dose 6 milligram. Okay.
Okay.
So how to do that? You can titrate. For example, you will give 5 ml, for example. Okay. And then you will check numbness in the hand. If numb, it's okay. If it's still no numbness, so you can titrate and so on. But the maximum should be how much?
6 mg per kg.
Okay, so first of all, you will prepare the maximum dose. Clear?
Okay. Clear.
So you will calculate 6 milligram. The patient, for example, 70 kilogram, for example. So 6 milligram multiply 7.
480.
So you will put in syringe and you will titrate. Easy?
Yes.
Okay. Well done. Thank you.
Thank you.
Next one. Aishwarya.
Yes,
So
sir.
this patient you have to put in monitored area. You have to examine the patient vital signs before and after the procedure, and then you will insert two IV access. You will put cuff here, and you will raise the affected arm up and feel the radial pulse until it will disappear. Then you will give the injection in the affected arm after confirming it's not leaking. Then you will inject the prelocaine. You will wait for 5 minutes to check numbness in the affected arm. Then you can do the procedure. Okay, well, okay. So, Ashwarya,
Yes, sir.
yes, how are you?
Fine.
You
Thank
will
you.
you will teach the junior doctor or junior nurse about wrist block. So you will block how many nerves?
3.
How many nerves, guys?
3 nerves.
How many nerves, guys?
3, sir. 3.
Five.
5. Okay. No problem, Naveed. Be calm.
Sorry, sir.
Naveed is
Sorry.
Naveed is
Okay.
too good.
Sorry, sir.
Most
Sorry.
intelligent guy.
Astaghfirullah.
Okay. So you will block 5 nerves. Of course, it is 3, but I'm joking. So to remember, so we have median, ulnar, radial. Okay. So in the palmar side, how many nerves? 3.
3.
Three, sir.
So this is the sum. Sum here, it means radial or ulnar?
Radial, sir.
Radial. So we are talking about radial nerve. The little finger, radial or ulnar?
Ulnar.
So we are talking about ulnar nerve. Easy?
PC.
Yes.
Then in the middle, median nerve. So how many nerves? 3. Radial, radial side, ulnar, ulnar side, and in the middle, median nerve. All of them deep or superficial?
Deep, sir. There is 2 superficial branches.
Yes. Anything serious? Anything serious should be deep. Okay. So here, when you are walking, this palmar side beside your body. So it's protected. That's why it's deep. Okay. We have in the dorsal side, I mean on the dorsum here, we have 2 nerves. Number 1 to the little finger,
Superficial branch of ulnar nerve.
ulnar, right?
Yes.
And to the thumb,
Radial.
radial. Excellent. Okay, so superficial or deep?
Superficial, sir.
Superficial. So any median nerve in the dorsal?
No.
No. Okay. So again, regarding the deep branches, we have radial, ulnar, and
Median.
median. And regarding the superficial, we have radial and
Ulnar.
Ulnar.
ulnar. So how many nerves now?
5.
5.
5. Okay, but in
Excellent.
the exam, don't say 5, say 3. Okay, so you will say 3. Number 1,
Radial.
Radial nerve.
radial, deep or superficial?
Deep
Superficial.
branch.
Deep.
Deep.
And then ulnar,
Deep branch.
deep branch. And then
Median.
Median
median,
deep branch.
don't say deep
Deep
branch,
branch.
and say it's deep. Because we don't
Ah,
have superficial.
yeah. Sorry,
Okay.
sorry.
Then you can say radial nerve, huh?
Superficial
Superficial
branch.
branch.
Superficial, and then ulnar nerve,
Superficial, sir.
Superficial branch.
superficial branch. Clear now?
Yes, easy.
Yes, boss.
Okay. Then we will go for the landmarks. So the landmarks, it will be around circle around the wrist. Okay. So you have how many centimeter?
2 centimeter.
Approximately
2 centimeter proximal to the wrist joint.
The wrist crisis.
the second, the palmar crease.
Proximal. Proximal wrist crisis.
Palmar
1
crease.
centimeter proximal to second palmar crease.
Yes.
Wrist
So
crease, sorry.
okay. Here, this is the first one, and this is the second one. So it will be here. Can you see this point? Okay. So you can imagine circle on this point. So you will inject the which nerve?
Radial nerve, sir.
Radial
nerve.
nerve here. Radial nerve here. Be 2 centimeter proximal to the crease here. And then the ulnar 2 centimeter proximal to the crease here, right?
Yes,
And
sir.
the median 2 centimeter, it will be proximal to the crease here. And then superficial, it will be 2 centimeter proximal to the crease, right?
Yes, sir.
And then the radial superficial, it will be also 2 centimeter proximal to the crease. Okay. So what you will do, you will draw interrupted line like that. Okay. Around the wrist, even here. Then you will imagine 2 centimeter here. So you will inject, it's up to you, perpendicular or 45 degree, no problem. Clear? You will inject 3 millimeter or 5 millimeter in each injection. How many times you will inject?
3 times.
5.
Two times. One superficial, one deep.
5 times. Okay. In deep, you will inject superficial first. Okay. So here, deep, you will inject the superficial and then deep. Here you will inject the superficial and then deep. Here you will inject superficial and then deep because all of them deep. Okay. This one you will inject
Superficial.
only superficial because it's a superficial. Clear now?
Yes.
This
Yes,
one
sir.
you will inject the superficial. Finished. Easy?
Yes, sir.
Yes, sir.
Okay. So the indication to numb the area, which area? The rest. To do any invasive procedure like suturing in the hand, removal foreign body, incision drainage in abscess, surgery, any surgery in the hand. The contraindication, the same. Complication, same. How to avoid complication, same. The procedure, you will clean the area and then you will cover by drape. You will expose only the landmark, the circle, 2 centimeter proximal to the proximal. Okay. Then you will inject. You have 3 nerves: radial, median, ulnar. In the palmar side, deep branches. In the dorsum side, you have 2 branches superficial, radial, ulnar. You will inject in each side 3 to 5 ml. In the deep branches, you will inject 3 ml superficial and then deep. In the superficial branches, you will inject superficial. It will be proximal or distal to the process.
Proximal to the process.
Proximal, sir.
So it will be 2 centimeter proximal to the crease and proximal to.
Ulnar style right process.
So for ulnar, you will say proximal to the ulnar styloid process. And for radial, proximal to the radial styloid process.
Styloid process.
Okay. So we still have 1 point. We still have 1 point. What is the point? You have to or 3 tendons. So for radial side, it's called flexor carporadialis, and for the ulnar side,
Flexor carpi ulnaris.
ulnaris. Okay, and you have palmaris longus, right?
Yes, sir.
Okay, so for the radial, it will be here the radial nerve, right?
Yes, sir.
Radial artery. Radial artery.
Sorry,
Later to
radial
the
artery.
flexor.
So the radial nerve, it will be between the radial artery and flexor carporadial. What about median? It will be between flexor carporadialis and
Palmaris longus.
Palmaris longus.
okay. And regarding the ulnar nerve, lateral or medial?
Medial, sir.
Medial.
Medial.
Because
Medial.
some is lateral, right?
Oh, yes.
So it will be medial to flexor carpi ulnar. Okay. Here's the anatomical snuff box. Why you will not inject here?
There is artery.
No, I mean you have here. You don't care about the artery because you will do regular aspiration, right?
Oh, yes.
Regular
Already.
aspiration. You will understand it's not in vein or vessel. But why you
Yes,
will
sir.
not inject in this area? This area, distal or proximal?
This is distal.
Distal.
Distal. If you inject here, you will block the distal branch of the superficial radial nerve. Easy?
Yes.
Okay, sir.
But you should inject here, right?
Yes.
Here, because you will block the proximal part of the superficial radial nerve. Okay? So here, the radial nerve here, right? Anatomical snuff box here. So when you inject, it will be proximal to the process, right?
Yes, sir.
Okay. So
Yes.
Shporia,
Yes, sir.
yeah, you have 30 seconds and then 6 minutes.
Okay, sir. Can I start, sir?
Okay, you can start.
Hello, my name is Dr. Aishwarya, Emergency Medicine Registrar. Can you please confirm your name and level? Hello, nice to meet you. I think you have something to discuss with me. Am I right? Oh, fantastic. You know, the wrist block is very important skill that is needed in ED. First of all, how much do you know so far regarding the wrist block? Okay, no worries. Do you want to know anything specific regarding the wrist block? Okay, then I'll start from the beginning. Thank you. So, today's lesson, I will divide into some learning objectives like types of wrist block and indication, contraindication, its complication, how to prevent the complication, and the technique and the equipments and the assessment. Okay. So, first of all, I need to ask you, what do you mean by the wrist block? Do you know? The wrist block means we are blocking three nerves. In the palmar aspect, we are blocking the superficial deep branch of radial and ulnar nerve and the median nerve also. Okay, in the dorsal surface, we are blocking the superficial branch of the radial and ulnar nerve. Okay, so the indications of the wrist block is to numb the area which is in the wrist part and the hand. Okay, for the procedures in the hand or wrist like suturing, foreign body removal. Okay, and the contraindications are like any infections in the insertion site or allergy to the local anesthetic we are using. Okay, and the complications are the infection, failure of the anesthesia, or the nerve injury, or the vascular injury. Okay, so how to prevent this complications? We must calculate the what dose of local anesthetic we should give. So that in this case, we are giving local anesthesia, the lignocaine. So the dose is 3 milligram per kg, maximum dose. Okay. And in extremes of ages, we need to reduce the amount of local anesthesia using, and we can use the ultrasound guided technique, and we can use the nerve stimulator as well. Okay, so next I will tell you about the how to ready the patient can sit in kept in. Patient can be in sitting position or lying down position, okay? And you need to wash your hand, wear the PPE, and you need to get ready with all the equipments needed for the procedure, like lidocaine, calculated dose, and 25 gauge needle or 30 gauge needle if pediatric patient. Okay, and syringe, chlorhexidine for cleaning, lipid emulsion solution if we have any toxicity, and ultrasound and the nerve stimulator. Okay, next is about the landmark. First, I'm telling about the radial nerve. Radial nerve, it is along the radial artery, lateral border of the radial artery. Okay, 2 centimeter proximal to the proximal wrist crease. Okay, palmar crease. Okay. And the median nerve, that is between the tendons of palmaris longus and the flexure carpi radialis. And the ulnar nerve is it is just proximal to the ulnar styloid process and medial to the flexure carpi ulnaris. Okay, did you understand? Okay, so next I'm going to the procedure. First, about the radial nerve. The radial nerve, we are injecting at the lateral part of the radial artery, 2 centimeter proximal to the wrist. Okay, and this should extend to the dorsal part till the radioulnar joint. Okay, and we can inject maximum 5 to 7 ml. Okay, we need to titrate the dose. And next is about the median nerve. Median nerve, we inserting the needle between the flexure palmaris longus tendon and the flexure carpi radialis tendon. Okay, and in order to get that tendon prominent, we can flex the wrist. Semi-flexed flexion is good. Then we need to advance the needle little more posteriorly, and you can inject maximum of 3 to 5 ml local anesthetic. Okay, and in the ulnar nerve, we are inserting the needle near the styloid process and medial to the flexure carpi ulnaris tendon. And before you are injecting this local anesthetic, confirm that we are aspirating out every time, because we should not inject the local anesthetic into the artery. Okay. Next, after the procedure, we need to wait for the 5 minutes and check with the forceps, make a prick, and ask the patient, is he knowing the pain? Okay. Once it is adequate analgesia got on the required space, we can start the procedure. Did you understand what I explained so far? Okay, do you have any questions? Okay, thank you. It was a pleasure to talking to you. In the next time, I will teach you further nerve blocks, and I will share you some website links to learn more about this. Okay, thank you. Sir.
Okay, thank you. You still have 25 seconds. How many marks, guys, will give Shwari?
10, sir.
9, sir.
Why?
10, sir. 10, sir. Mashallah. 10.
Mashallah, sir.
Documentation,
10.
post procedure advice and documentation.
Oh. Yes.
Okay. So here regarding this procedure, nerve block, all nerve block, as we said, it will be teaching, unlikely to find the patient. Maybe mannequin, but unlikely to find the patient. Okay. Maybe no mannequin also. So you will imagine, just imagine. So in this station, if you don't find the patient or mannequin, just make on your wrist. Okay. How to show the tendons? How to show the tendons? You can make fist like that, or you can hold the thumb and the little finger together. Can you imagine, guys? You can do now. You will find all the tendons clear. The thumb and the little finger opposition.
Yes,
Okay.
sir.
So you can practice on your wrists in the exam. You will show him like that. Okay. So you can tell him we have 3 deep branches here, radial, ulnar, and median, and you have 2 superficial branches here, radial and ulnar, and so on. Okay. This station is clear, guys?
Can I ask one question, Dr. Hani?
Yes, sure.
When we have to inject to numb the median nerve, either we have to go beneath the palmaris longest tendon.
All perpendicular.
Okay.
All injections perpendicular.
Thank you very much. Thank you.
Welcome. Okay. If you want to make 30 degree, okay. If you want to make 90 degree perpendicular, it means a 90, right? If you want to make 90, okay. 45, okay. 30, okay. No problem. So is this how much is the degree?
What is it? 30 degree or
It's like 30, okay.
Almost 30.
This one, superficial, okay. So it's up to you.
For median nerve, Dr. Hani, in which direction we will go?
Sorry,
For median nerve.
we said perpendicular. All nerves in the wrist perpendicular.
Okay.
I said if you want to make perpendicular, okay. If you want to make 30, okay. If you want to make 45, okay. I wish I'm clear.
Yes, sir.
Yes,
Yes.
sir.
Okay.
Yes, sir.
Yes, sir. Yes, sir. Yes, sir.
So this one for ulnar nerve, okay. This one for median. This one superficial dorsal. Okay. Next one, Afshan.
Yes, Dr. Hani.
Your voice is far.
Hello, now I'm clear.
Okay. So here hematoma block. It means you will inject this one, not intravenous, guys. Okay? Not intravenous. It will be, wait, so you will not be confused. Okay. Where you will inject?
Into the
In the
hematoma.
fracture.
In the
Hematoma.
fracture site, yes.
The practice.
Yes. The patient has fracture. You can use ultrasound, and if not available, you can use the landmarks. So the landmarks here, it will be inside the site of the fracture, between the 2 ends of the fracture bone. Okay. So here you find the vessels. You find the vessels
No.
here in the bosom? No.
No.
So most of vessels, it will be deep, right? In the palmar
Yes.
side. Okay. So here, no worries. Even you are not doing regular aspiration, no problem. You will find a hematoma. So you will inject inside the hematoma. And after 5 minutes, you will wait for numbness, and then you can do reduction of the rest. So the indication here, to numb the area around the fracture site, then you will do reduction. You are using for which indication? Distal fracture, distal limb fracture. So distal means in the wrist or ankle, right?
Yes, sir.
Yes,
Distal
sir.
means in the wrist or ankle. So you can use in wrist fracture or ankle fracture. Okay. You have 30 seconds and 6 minutes.
So can I start?
You can start.
Good morning. I'm Dr. Afshaidi Registrar. May I confirm your name and grade, please? I've been told to teach you hematoma block. So please tell me how much do you know about it? Okay, so anything specific you want to know? Okay, so today I will set the learning objectives. I will teach you the indication, contraindication, complications, the technique of the hematoma block, how to prepare it, and position the patient, and then post-procedure advice management and documentation. So I will also teach you about, tell you about some online sources. And if you find anything difficult, so you can ask me. Is that okay? Okay, so let's proceed to the patient. Hematoma block we use for distal fracture of the limbs, and contraindications are uh, the infection at the site of injection or any coagulopathy, and any allergy to the local anesthesia. Complication could be like bleeding or anesthesia toxicity, and procedure for the patient. We will keep the patient on the dorsum, on the dorsal aspect of the limb, and after cleaning the skin with biodine or chlorhexidine, we will take local anesthesia 3 to 5 ml in a syringe, and then identifying the fracture site, we will inject the syringe into the fracture between the two fracture sites of the bone inside the hematoma, and then we don't need to aspirate it. Then we will inject 3 or 5 ml of local anesthesia into the fracture site. That will create anesthesia of the distal arm. We will wait for 5 minutes for the effect of anesthesia, and then we can reduce the fracture like Colles fracture in the arm or any fracture of the ankle. Are you following me what I'm telling you? So this is quite a simple procedure. We do hematoma block for to numb the area of distal limb. Is that okay? Any question you want to ask? Okay, thank you.
Okay,
I'm done.
thank you. Thank you, Afshan. You still have 2 minutes and 45 seconds. How many marks you will give Afshan, guys?
Sir, 8, sir.
Okay, why?
Sir, when they inserted the needle into the fracture site, first to aspirate and look for the any blood in the syringe or not, to be sure that it is inside the hematoma. And after this is the missing point and very
Okay.
important.
What else? Did she mention the indications,
Yes, she
contraindications,
yes,
complications?
yes, sir. How to prevent the complication? He didn't told us.
Yes, she did not mention how to avoid complications. Okay.
Yes.
So, how to treat the complications?
No.
No. So, how to avoid accurate calculation of the dose, adequate and accurate calculation of the doses, reduce the dose in extremes of ages. Okay. Did she mention the dose?
No.
No, sir.
She is unsafe, doctor. Okay. So she will inject which injection of anesthesia? Is it lidocaine, brolocaine, buvocaine?
Yes, I missed that.
So you are unsafe, doctor. Okay. Do you think you will do the procedure without anesthesia?
I just mentioned local anesthesia. I didn't mention the name.
Yes, it's important. Why? Because lidocaine, how long is the action, the duration?
90 minutes.
90 minutes.
So 1 to 2 hours. Lidocaine, 1 to 2 hours. It's very short. You will use in short duration procedure. For example, you are putting in the face. Why in the face? Because it's short. After 1 hour, the patient will be okay, right? Okay. Then buvocaine. It will take how long?
Too long.
Longest.
6 to 12 hours. Okay. That's why we put in fascia iliaca nerve block. Clear now?
Yes, sir.
Okay, so it's important to mention the type of local anesthesia, the name, okay, the dose also. You have to prepare intralipid, you have to use ultrasound guidance, but if you don't have, no worries, you can depend on the landmarks. Did you mention you will feel the two ends of the fractured bone?
Between the two ends of the bone.
So you should
No.
mention that, okay? So I will give you 6 marks, okay?
Oh, okay, sir.
Okay, thank you. So here, accuracy almost mentioned all the points, but not all. Um, regarding the skillfulness, you are fluent. Regarding the supportiveness, you are supportive. You are giving information in pieces. You are pausing. You are checking understanding. You are not rushing in time. Regarding safety, you are unsafe, doctor, because you did not mention these points. Okay. Next one, May.
Yes, doctor.
Okay. So this procedure, you will insert the needle and then you will aspirate. If you find the blood coming out, it means you are inserting in the hematoma site, and then you will inject 3 to 5 ml lidocaine, maximum 3 milligram per kilogram, and then you will wait for 5 minutes to check numbness of the wrist. And then you will do the procedure, you will do reduction, you will do X-ray. After that, you will do back slab, and you will check for any local anesthetic toxicity. If you will mention local anesthetic toxicity as complications, so how to treat that? So you will move the patient to uh, monitor the area, oxygen, fluids, and intra-lipid in case the patient collapse. Okay. If the patient in cardiac arrest, you will follow ALS approach. Clear, Afshan?
Yes, sir. Clear.
Please,
you.
these points very, very important.
Yes, sir.
Okay.
Thank you.
May?
Excuse me, sir.
Yes,
Yes.
doctor.
Sir, my concept is not clear on this point. First, sir, we will inject aspirate when we found there is blood coming. So we will first aspirate all the hematoma, then we will inject local anesthesia.
The syringe now with local anesthesia, right?
Yes, sir. Yes, sir.
Here, for example, lidocaine. Okay. So
Okay, sir.
you will insert the needle.
Correct,
Okay.
sir. Okay.
Then you will aspirate. You will find the blood coming out. It means it's in the correct site.
Yes, sir.
Okay.
Okay.
This blood from the bone marrow, uh, not from the vessel. Okay.
Okay.
I mean from the wait. I will show you this one. This blood from here. from the hematoma, from the swelling collection. Clear now?
Okay, sir. Okay.
Yes. If you will inject the lidocaine here, don't worry, it will not reach the circulation because here absorption is not fast. Clear?
Yeah. So, sir, first we will aspirate the full hematoma, then we will inject, or
No, here you will insert already lidocaine in the syringe. You will insert inside the site of the fracture, between the two ends of the fractured bone. Then you will aspirate, you will find the blood coming out, then you will inject all slowly.
okay.
Clear?
Okay, sir. Clear. Okay.
Very easy. Okay.
Thank
Like that. Okay.
Sir, can I ask?
Okay, sir.
Okay.
Sir, can I ask if there is blood is coming, how will you differentiate between it is from hematoma or from vessel?
It means you are not listening to us. Anyone can answer, guys.
Yes.
Sorry.
First, the color in the hematoma is dark, and if it is in the vessel, it is
No,
red.
no. We mentioned earlier the vessels here.
Here,
in-
yes,
The
yes,
vessel,
yes.
vessels is outside.
Yes,
Here there is no
vessel is
photo.
on the flexor surface, not on
You
the
have
dorsal.
you have radial. Sorry, guys, please wait. You have radial artery here, up or down.
Down.
Clear?
Yeah.
We mentioned that earlier because of this point. Okay. If you want to
Okay.
pass with very high score, you should listen to us by letter, by name, by word. If I mention anything, mention the same. Okay? If you are not
Okay.
listening, for sure, it's like nothing. Okay. Next one, May.
Yes, doctor.
Okay. Digital nerve block, it means you will insert where you have
The
four,
base of the
you have four nerves, two palmar and two dorsal, right?
yes,
So you will inject here. Okay.
yes,
So you have two sides, palmar and dorsal, right? So
yes.
not to use the palmar side, better to use the dorsal side. Okay. So you will inject in the dorsum between the two digits in the web space, and you will advance the needle superficial. Okay. You will inject. Now you are injecting for what? For which branch? Dorsal.
Branch.
Dorsal branch. Okay.
Yes.
Then you will advance the needle down deep, but don't reach the palmar side. Clear?
Okay.
Don't
Yes.
penetrate the palmar side. So you will inject from the dorsum, but don't penetrate the skin in the palm. Okay? So
Okay.
here you are injecting one time on the left side or the medial, because little finger medial, and then you will inject on the lateral side. It means beside the thumb, right?
Okay.
Clear?
Yes.
Yes, sir.
Okay. So here, for example, this is the middle finger. You will inject here on the medial side two times. Not two times, one time, but you will advance
One
it.
time. Yes.
One time superficial and then go deep to reach the palmar side, palmar branch. Clear?
Okay. Okay.
Yes, sir.
Then you will go for the radial side. So this ulnar side, this radial side. You will inject here one time, but you will inject superficial and then go deep. Here you will inject superficial and then go deep. Easy?
Easy, sir.
So it will be proximal or distal to metacarpophalangeal joint?
It is distal.
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 Okay, you have 30 seconds and then 6 minutes. The most important in how to avoid the complication, it will be the same, but you will add, don't use adrenaline.
Adrenaline. Okay. Okay.
Okay, you have 30 seconds and 6.
Okay. Okay, shall I start?
Okay, you can start.
Hello, good morning. I'm Dr. May, one of the ED registrar. May I confirm your name and level, please? Okay. Nice to meet you. I believe we have something to discuss today about digit network. It's really nice topic. Okay. How do you know so far about it? Okay. Do you have any specific point you want us to speak about? It's okay. So I will discuss with you today regarding this topic, and at the end, I will give you websites and videos you can learn more from it. Okay. So we have our objective for today. The pre and during and post procedure. Okay. So you can feel free to ask me any question at any point. So for the procedure, pre-preparation, we have the indication, contraindication, and complication, how to prevent this complication, and how to treat the complication. Regarding the indication for the block, it's to numb the area. If we have procedure at that site, to numb the area, okay? And contraindication, it could be when the patient refuses the procedure, if there is the procedure is need general anesthesia, or the patient has allergy from the anesthetic material. So regarding the complication, we can face sometimes we are facing complication uh, like bleeding, like infection, okay, and like toxicity from the overdose. So how to prevent this complication? We have to check the dose accurately, and we have to consider the extremities of age. So we have to reduce the dose. Plus, we can use an ultrasound guidance to guide us. In case a complication happen, okay, we can just treat this by stop the procedure directly, shift the patient to monitoring area, connect all the monitor, give him oxygen and fluid, and give him interlipid also. Okay. Here, are you following so far, Doctor? Okay, good. So here we can use lidocaine. Okay, and we have to calculate the dose. Lidocaine, the maximum dose is 3 mg, 3 mg per kg. This is the maximum dose for lidocaine. So, but doctor, please remember not to use adrenaline with lidocaine, because we can facing like as you know, it can cause like ischemia to the digital. Okay, so to the digit. So now we came to the during procedure. During procedure, we have to prepare the patient. The patient would be either sitting or lying supine, no problem. And for us, we have to wear our gloves, the BBE, and we have our equipment like the needle, it's 25 or 26 gauge, small needle, and we have the lidocaine or the anesthetic material. Okay, so here we will use lidocaine to block the digits. Okay, so in the procedure we have to first we have in the digit we have two branches, dorsal branch and palmar branch. So you will do like you will start from the dorsal branch or either plantar branch. It's okay, no problem. For example, here we will start from the dorsal side. Okay, you will inject the needle at the base of the digit. Okay, at the base of the digit, you will inject the needle, okay, from the dorsum side, and then advance the needle, okay, but don't touch the palmar side. Okay, before you touch the palmar side, you will inject 0.5 ml, like 0.5 ml lidocaine, and then you will withdraw the needle. Okay, before you take the needle out, you will inject 0.5 ml of lidocaine. So by this way, you will numb the area, palmar side and dorsal side. Okay, so you will come to the other side in the same digit in the page, okay, of the digit, and you will repeat the same way as you did here in the medial side. Okay, so after that you have to wait like 5 minutes. Okay, and after 5 minutes the area will be knocked, and then you can proceed your procedure. Okay, regarding the post procedure, after you finish from the small procedure you want to do on this patient, so you will give him advice and check the patient is vitally stable, and after that you will dispose all your equipment and document your procedure. Is that okay so far, doctor? Okay. So any question you want to ask? Feel free. It's okay. Okay, so let's recap what we're saying today. You came for me and asked me to teach you about nerve block. Okay, we start with dividing the procedure to pre, during, and post. Okay,
Thank
and
you. You mind?
okay.
Okay, your time done. You finished already, before 30 seconds, but you tried to recap because you still have time. Okay. How many marks, guys, you will give mine?
15 out of 10. Excellent.
Full marks.
Okay, well done. So I think she's doing very well. Accuracy, she's very perfect, 100%. She mentioned almost all the points. And regarding, did she miss any point?
No.
Anything specific? She want,
Lipid emulsion he missed.
Okay. So
Emulsion.
regarding
Mention.
skillfulness, she is fluent, and regarding supportiveness, she is doing very well, posing pieces of information and also checking understanding. She tried to recap also. When you are recapping in the exam, if you still have time, you can just mention the highlights. For example, you can tell here. Already I discussed with you the indications, the contraindications, the complication. So you can ask her if she want to know anything specific in the end also. No worries. Invite questions. Okay, well done. I think you did very well. I will
Dr. Han, I'm sorry, 1 minute. About the 0.5 ml, she mentioned that before taking out the needle, just insert the 0.5. I don't understand this point. Can you please explain?
You will insert the needle in the space between the two digits, okay?
Okay. Okay.
So you will choose, for example, the medial side.
Yeah.
Medial, it means towards the little finger.
Yes.
It will be distal to metacarpopharyngeal joints.
Yes.
You will insert the superficial. It's up to you if you want to insert 30 degree or 45 or even perpendicular, no problem. Clear?
Okay. Clear.
Okay. So don't make things difficult for you guys. Don't say, I will insert a perpendicular or I will insert a 30 degree or 45 degree. No problem. The most important, you will inject the lidocaine and it will be infiltrated, right?
Yes.
Okay. So, for example, you will insert here perpendicular or 30 degree like that. Okay. The most important, you will insert injection superficial first, like 3 ml, and then you will advance the needle down, but don't penetrate the skin in the palm. Easy?
Okay.
I wish it's clear for you.
Yes, sir.
Yes.
Okay. And you will repeat on the radial side.
Okay. So we will give the 3 ml on the palmar side also, or How much will infiltrate? Like 3 to 5
So
ml on the
you will
dorsal
you
side?
will, you will give now 3 ml
Yes.
and superficial, and then you will insert more, like 1 centimeter. Okay,
Yes.
you will advance the needle like 1 centimeter, but try to not penetrate the skin of the palm. Then
Yes.
you will inject further 3 ml.
Okay. Okay. Thank you.
Then you will repeat here 3 ml superficial,
Yes.
then advance the needle and then inject 3 ml again. Easy?
Excellent. Thank you. Sure.
Yeah, welcome. Okay, next one, Muhammad.
Dr. Hani, can I ask one thing?
Yes, sure.
You have told us this digital nerve block by the two prick method. Is there any other method which is single prick method on the palmar aspect we have to inject on the palmar crease?
I prefer this one, the dorsum side.
Okay, sir. Thank you.
Yes, because in the palm may be painful here.
Okay. Thank you.
Next one, I think Kashif. Kashif? Okay. Kashif?
Sir, actually, I just started one patient. Can I do after
Shayati?
this? Sorry.
Shayati?
Yes, Dr. Han. Good evening.
Good evening. So, Shayati and Nelly. N-
Good
N-
evening.
Good evening. So, Shayati will do fascia iliaca nerve block, and Nelly will do femoral nerve block. Clear?
Okay.
What is the indication for Shayati and Nelly? So, both similar approach. I will give you idea. So, for fascia iliaca nerve block, you will block how many nerves?
Three nerves.
3 nerves.
3 nerves. And for femoral?
1 nerve.
One.
One nerve, the femoral nerve. Okay. So, in fascia iliaca, better. Fascia iliaca, better. Why? Because you will block 3 nerves. It means you will block
The anterior compartment of the thigh.
big area. You will
Yes.
block big area. Okay. So, here regarding the landmarks. So, for femoral, where, Nelly?
You palpate the femoral artery in the midpoint, then move laterally.
So you have vein, artery, nerve from medial to lateral. Vein, artery, nerve. So it will be below the inguinal ligament, 1 centimeter. It will, if you divide the line between anterior superior iliac spine and the pubic tubercle, and it will be
Midpoint below.
midpoint. Okay. So here, this line you can use for femoral nerve block or fascia iliaca nerve block. So for femoral, you will say 1 centimeter below the inguinal ligament. It will be lateral or medial to the femoral artery.
Lateral.
Lateral.
It will be lateral. Regarding fascia iliaca nerve block, you will divide the line into thirds. It will
Yes.
be the junction between.
Lateral 1/3 and medial 2/3.
Okay.
Yes, sir.
So here, regarding this one, which muscle?
Iliacus muscle.
Your sauce.
Iliacus, not sauce.
Iliacus muscle.
Okay. So you will find two layers. So you have this one,
Fascia iliaca and fascia lata.
fascia lata, and then fascia iliaca. Which one is first?
Lata.
Lata.
Fascia lata.
Yes, you will puncture fascia lata and then you will puncture fascia iliaca here. Okay, so you will inject deep or superficial?
Deep to the fascia.
Excellent, deep. Any injection for lidocaine will be superficial. Injection for bupivacaine will be deep. Okay,
Yes.
Okay.
so you will inject lidocaine here superficial to numb this area, the skin and the subcutaneous tissue, and then you will inject bupivacaine. Clear now?
Yes, sir.
We'll use two needles. One
Okay.
needle superficial, lidocaine, 3 ml or 5 ml, and then you will wait for 5 minutes to numb the area, and you will inject for bupivacaine. Lidocaine, it will be maximum 3 milligram per kilogram, and
Yes.
bupivacaine, it will be maximum
2 milligram per kg.
2 milligram per Yes, excellent. Okay, so for Shahati, fascia iliaca nerve block, here you will insert perpendicular, right?
Yes.
And for Nelly, also you will insert perpendicular. You have needle and the syringe. For Nelly, needle and the syringe. For Shayati fascia iliaca nerve block, it will be two syringe, 20 and 20. For Nelly femoral, it will be one syringe, 20. Clear?
So I will do
Like a no lignocaine in nerve block, femoral nerve block.
Sorry?
I'm saying in the femoral nerve block, we shouldn't anesthetize the skin with lignocaine, no. Just for fascia iliaca.
For both. You will do for both. You will inject it deep or superficial?
Superficial.
Deep.
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 You will inject deep. Here you will inject deep. Here you will inject deep. You will inject, penetrate fascia lata, and then fascia iliaca in both femoral nerve. How you will reach femoral nerve? Deep or superficial?
Deep, sir.
Deep. So you will inject superficial and then you will inject deep. Okay? Here also you inject superficial and then you will inject deep. Okay. So here in femoral, you will inject 20 ml. I'm talking about the deep, not the superficial. You will inject only one syringe, 20 ml, over 5 minutes. Regarding fascia iliaca, you will inject 2 times Shayati. One syringe 20, and then one syringe 20. Clear?
Okay, so it's 20 gauge needle you are saying, right?
You will
20
insert
ml.
both
20
of
ml the amount.
20
The amount.
ml.
40
Yes.
ml in total.
40
So
ml
total
total.
40 ml. Yes. Okay.
So you will inject superficial and wait for the skin to be numb, and then insert a large needle, deep needle, and syringe. Prepare
Yes.
2 syringe, each one 20 ml. You will infiltrate 20 ml slowly. After that, remove the syringe, keep the needle, don't remove the needle. Then
Yes, that one.
inject the other 20 ml. Clear? But for femoral, it's only one time 20 ml. Clear now? So
Yes, clear.
for Nelly, you will inject numb or block femoral nerve only. But for Shayati,
Two. I will first
three,
fascia iliaca, fascia lata, and then fascia iliaca. So I will do it.
three nerves, three
Oh,
nerves.
3 nerves. 3 nerves, yes.
Number 1, femoral nerve. Number 2,
Lateral cutaneous nerve.
obturator
Obturator
nerve,
nerve.
and the lateral cutaneous femoral.
Cutaneous nerve.
Okay. So again, you have to numb femoral nerve and lateral femoral cutaneous nerve and the obturator nerve. Clear?
Yes.
Okay. So we will start by Shayati.
Dr. Honey, do we use the blunt needle or sharp needle?
For which point? What do
Facial
you...
occur block, sir. Facial occur block.
Yes, blunt.
Yes.
Okay.
So,
So
Dr. Hani, this landmark is junction between lateral 1/3 and middle 2/3, but we should be 1 centimeter below or not?
yes, no problem. But here the most important, you will mention the junction between the lateral 1/3 and medial 2/3.
Yes.
Okay. For Nelly, it will be 1 centimeter between inguinal ligament, below inguinal ligament, lateral to the maximal pulsation of femoral artery. Okay. Okay. You have 30 seconds and 6 minutes. So here, for fascial iliac nerve block, most likely for a fracture neck of femur. Here for femoral nerve, most likely for mid shaft fracture of the femur. Clear?
Yes.
Okay. So you should emphasize on the safe dose and also the action. So lidocaine, it will be 1 to 2 hours, but Buvacaine, it will be 6 to 12 hours. So you will wait, you will do reduction after that, and the patient will do ORF. Okay, you have 30 seconds and 6 minutes.
Okay, I can start.
Okay, you can start.
Hello, I'm Dr. Chaiti, Emergency Registrar. May I know your name and level, please? Nice to meet you. Believe you have something to discuss with me. Okay. So you want to learn about fascia iliac block. That's a very important skill. So how much do you know so far? Anything specific you want to learn? Okay. So today I will set you a learning objective. We will learn about the indication, contraindication, complications, how to prevent the complication, the procedure, and the assessment of the success of the procedure. And after that, we need to document the procedure. Okay. So now we will begin with the indication. Now we are doing the fascia iliac block for mainly the anterior compartment of the thigh. It's for the neck of the femur, the pre-operative analgesia. Or if you want to do a wound exploration of the anterior compartment of the thigh, we are doing that. Actually, to numb that area, we are numbing the 3 nerves. That is the femoral nerve, obturator nerve, and lateral cutaneous nerve. So it's a huge area we are numbing this patient. Now, after the indication, what could be the contraindication for this patient? The patient's refusal, or the patient needs an operative procedure which has to be done in an operation theater, or the patient is having a local anesthesia toxicity, or it could be a hematoma on that side. Now, how to prevent this local adverse complication? We have to give a accurate dose of the local anesthesia. Number 2 is we have to do reduce the dose in the patients who are elderly and who are children. Number 3 is ultrasound guide. Now, if there is a complication, how to prevent it? We have to stop the procedure. Number 1. Number 2, we have to shift the patient to the monitored room, give high flow oxygen, give IV fluid, and then we have to keep intralipid ready in case if the patient is having collapse or the patient arrests. Okay. Now let's start with the procedure. So procedure, when we are starting, we have to prepare ourselves, number 1. Number 2 is we have to prepare the equipments and then the steps of the procedure. Okay. So for this, did you understand till now? If you have any doubt, please feel free to ask me. Now, how to prepare ourselves? Wear the PPE and then take what is the local anesthesia needed in this? We have bupivacaine and we also have to take lidocaine. Now, why we are taking lidocaine? Because it will give a superficial anesthesia, and its long is 1 to 2 hours, and bupivacaine is for 6 to 12 hours. Now we have to take 2 syringes and 20 ml of lidocaine and 20 ml of bupivacaine in 2 syringes and 1 needle. And then what we have to do, we have to drape that area, clean that area. After that draping an area, we have to start doing the landmark. What is the landmark? Landmark is junction between the lateral 1/3 and middle 2/3. That junction, that point, 1 centimeter just below that is our fascia iliaca block. But be careful about the nerve and the vessels, because it is just medial to the nerve. After identifying the landmark, then we are starting to inject. First, we will superficially inject the lidocaine, which we have taken the 20 ml. We'll go 5 ml, then aspirate, and then again inject that area. And we will, after injecting, we'll wait there for 5 minutes. We will check the numbness of the patient is there. Then we will go deeper. Deeper, we are going bupivacaine at 2 ml per kg. Then we are injecting deep inside. The total is 20 ml of lidocaine, 20 ml of bupivacaine, so total of 40 ml. So how do we do that? After giving the lidocaine, we will keep the needle perpendicularly as it is, and then we will remove the syringe and give another syringe, which is with bupivacaine. After injecting that, we will wait for the area, everything, and then we can start with the procedure. If you have any doubt, you can please clarify with me, or I can do another recapitulation. So after doing the procedure, what we will be, most of the patients, because this is a neck of the femur fracture, this is operative, the patient has to be referred to the ortho specialty. So but in our emergency, after the procedure done, you have to monitor the patient, check all the vital signs, and if any toxicity, they have to take the assessment for any toxicity. And all this procedure need to be documented in our system. So hope you understood this. If you have any doubt, you can clarify for me, or I can go for another recapitulation for you. Just the indication, contraindications, complications, and we can just recapitulate about that. Thank you.
Okay, thank you. Shayati, still have 45 seconds. How many marks, guys, you will give Shayati?
MashaAllah, excellent.
Thank you very much.
Excellent. Yes.
And
But the dose of local anesthetic, I think it's wrong.
3 ml, no? And 2
I have
ml.
a question. Are we supposed to give 20 of lignocaine and 20 of bupivacaine?
Yeah. So I gave 20 and 20, and lidocaine is 3 ml per kg, and bupivacaine is 2 ml per kg.
So
Uh,
actually,
40 ml. Wait, guys. 40 ml, you will give all bupivacaine.
Yes.
So 20 ml bupivacaine, then 20 ml bupivacaine.
Oh, that I made mistake.
Yeah,
Yes.
because I think she said
Spoke as lidocaine, so it should
20
be bupivacaine.
lignocaine and 20 bupivacaine.
No,
So
no.
You misunderstand. You misunderstand. So here regarding the large needle, it means deep injection. If I say
Yes.
deep injection, I'm talking about bupivacaine. Clear?
Yes.
So,
Yeah. That I said wrongly. Yes. 40 and
so
bupivacaine. Yes.
first you will inject the superficial by a small needle, thin needle. Okay, you will inject in this area up, superficial. You will inject lidocaine 3 ml
Yes.
lidocaine. Okay, then after 5 minutes, you will give 20 ml bupivacaine with large needle. It will be deep. You will feel 2 pops, fascia lata puncture, and then fascia iliaca puncture. Then you will reach to the iliopsoas muscle. Clear?
Yes.
You will inject 20 ml bupivacaine slowly. After that, you will remove the syringe, keep the large needle, the deep one, and put another syringe with another 20 ml of bupivacaine. Clear?
Okay.
Yes, sir.
Yes, because I think she gave 20 lignocaine,
Yes.
20
that I
She,
got.
bupivacaine.
she
That I got.
misunderstood. She misunderstood.
I misunderstood.
So I will give you 7 marks because of this mistake.
Yes, yes.
Okay.
Okay, doctor.
So here, if you will give the first 20 ml lidocaine, it will finish after 1 or 2 hours. No benefit.
Yes.
Yes, it will numb. Yes, but it will uh, wear off like 1 or 2 hours. Okay.
Yes.
So you are depending on 20 ml of Novocaine. So it should be 40. Okay.
Okay.
Next one, femoral nerve block for Nelly. You have 30
Yes.
seconds, then 6 minutes. It
So
will be
just to confirm a point for femoral, give 3 mils lignocaine, wait for 5 minutes, then give 20 mils bupivacaine, right?
yes, but you have to mention why you will give lidocaine. So you will give lidocaine by a small needle, thin needle. It will be superficial to numb the skin and the subcutaneous tissue, so the patient will not feel the deep needle. Clear?
Okay.
Then you will insert the large needle, okay, to puncture the two fascia lata and the fascia iliaca. You will feel two bobs, and you will reach the uh, close to the iliopsoas muscle beside the femoral nerve. Okay. For the safety or for the precautions, you will use nerve stimulator, right?
Okay.
This nerve stimulator already attached to the needle. Once you inject the buvocaine, okay, you will find twitching. So anyway, this is not important for the exam. Just to mention, you will use ultrasound and the nerve stimulator. No need to explain anything else. Okay. Okay. The most important in fascia iliaca, you will mention you are blocking 3 nerves: femoral, lateral cutaneous nerve of the femoral, and obturator nerve. For you, Nelly, you will mention you are blocking only the femoral nerve. Okay, you have 30 seconds and 6 minutes. You can start.
Hello, good morning. My name is Dr. Nelly, ED Registrar. Can I just confirm your name and level, please? Okay, nice to meet you, doctor. I understand you have something to discuss with me today. All right, no problem. That's a good topic to learn. So, is there anything specific you'd like to learn about the femoral nerve block? How much do you know so far? All right, no problem. So before we begin, I'll just set objectives. So we'll learn about the indications, contraindications, complications, how to prevent and treat complications, how to prepare the patient, how to prepare ourselves, how to do the procedure ourselves, how to document and give post-procedure advice. Is that okay? So if you don't understand anything, please feel free to stop me and I'll recap and repeat myself. Thank you so much. So now we can begin. So femoral nerve block, the indications of femoral nerve block is to block the femoral nerve and or the area of its distribution. That's the anterior thigh, the knee, the medial aspect of the leg, and the medial aspect of the ankle. That's the distribution of the femoral nerve. This is usually used especially in cases where you have a femur fracture, the shaft of the femur fracture. That's the most common place when we use the femoral nerve block. That's the most common indications. For contraindications, if the anatomical landmark where you're supposed to use there's distorted anatomy and you really can't be so sure if the procedure will be successful, then you shouldn't do that. If there's any infection in that area, for example, you have cellulitis, you shouldn't be using a femoral nerve block. Or if a patient needs general anesthesia, you shouldn't be using a femoral nerve block and stays. In that case, you need to go for general anesthesia. Those are the complications. Those are the contraindications. For complications, you can, because you're using in an area where there's so close to the femoral artery, you can injure the femoral artery. You can also cause infection in that area, or you can develop complications from local anesthetic toxicity. So how can we prevent those complications? First of all, to prevent injuring the femoral artery, we need to make sure we understand our landmarks, and we need to use ultrasound guidance as well as a nerve stimulator. To prevent infections, we need to clean our area properly and drape the area properly. In order to prevent complications of local anesthesia, we need to make sure we clearly and accurately calculate our doses. We need to reduce our doses in patients who are frail or patients in extremes of age. We also need to make sure as we inject our local anesthesia, we need to do it slowly and regularly aspirating to make sure we're not injecting in the femoral artery. Am I clear so far? Do you have any questions? Okay, so in an instance where the patient develops complications, we need to move the patient to a monitored area, do our ABCD assessment of the patient, and manage the complications accordingly. So I'll give you another lecture on how to manage the complications. Do you have any questions so far? So how do we prepare for the procedure? We need to prepare the patient, explain the procedure to the patient, and obtain consent. Take the patient to the monitored area, and the patient should lie supine in bed. And how do we prepare ourselves? We need to collect our equipment, collect 2 needles, the small needle to prepare the skin, and a larger needle to inject the area. We need a 20 ml syringe because we need to inject bupivacaine, about 20 ml. We need 2 different types of local anesthesia. We need lignocaine for the skin preparation, and we need bupivacaine for the procedure. We also need cleaning material and drips. So go to the patient who's lying supine in bed. We will locate our landmark. We'll palpate the pubic tubercle as well as the anterior superior iliac spine. On that midpoint, we're going to find the midpoint of the inguinal ligament. We have to move down by 1 centimeter from that midpoint and move laterally because that's where the femoral nerve is. That's our landmark. We can mark that landmark. We should clean the area properly, drape the area, get 3 ml of lignocaine, inject superficially to anesthetize the skin before we use a deep needle. After 5 minutes, you can then get your 20 ml of bupivacaine and inject deeply. To make sure you are in the nerve, you should look at your nerve stimulator, as well as should feel 2 gives. That means you have injected. Should feel the give, the first give of the fascia iliata, and the second give of the fascia iliaca. Once you've finished, wait for some minutes before you can carry out your procedure. Once you're done with your procedure, you can dress the patient appropriately, discard all equipment, and give the patient written advice on how to identify any complications. Tell the patient if they feel any dizziness, any metallic taste in the mouth, any visual disturbances, any tinnitus, they should report to you. Thank you so much. So document your procedure clearly. Do you understand? Do you have any questions? Okay, so I'll just recap a little bit.
Thank you. Your time done. Okay, how many marks, guys, will give Nili?
10, sir.
MashaAllah, sir, 15. Hari, pronunciation very clear.
Really
Excellent,
impressed.
excellent. Yeah, outstanding performance, no doubt.
Yes, tone is excellent.
Okay, so she is using the approach of teaching. She's very calm, very professional, very confident, and also she's pausing. She's not rushing in time. Accuracy, all points covered. Did she mention the dose?
Yes.
No. Only mention the 20 mils and 3 mils. but don't mention the dose. Lidocaine 3 milligram per kg and bupivacaine.
Yes.
You mean the maximum dose,
Yes.
maximum safe dose. It's very important. Okay.
Yeah.
So you will inject 20 ml bupivacaine, maximum safe dose 2 milligram per kilogram. Okay. And the lidocaine for superficial, it will be 3 ml or 5 ml, maximum safe dose 3 milligram per kilogram. Okay. Any missed point?
No.
Organization organized?
Yes.
She's safe, doctor?
Of course.
But she did not mention safe dose.
We need to aspirate everything.
Okay. So I will give her 8 marks. Okay.
Sir, for femoral nerve block, we need to aspirate, right?
Yes, any injection, you should do regular aspiration. So I want you to fix this approach in all nerve block. So how to avoid, number one, adequate, accurate calculation of the dose. Number two, reduce the doses in extremes of edges. Number three, you will do a slow injection and regular aspiration. Fix this approach in all nerve block. Clear?
Yes, sir.
Okay. So if you did not mention that during the procedure, no problem. Already you mentioned that in the how to avoid the complication. Okay. Well done. Thank you. Next one. Let's see. Yara?
Yes, sir.
Yes. Okay, we'll finish this one, femoral also. Okay, ankle nerve block. So ankle here, you will block how many nerves?
5.
Okay, so the indication to numb the area in the ankle and to do any procedure, invasive procedure in the ankle, like suturing, like removal from body, draining abscess, or any surgery in the ankle. Contraindication same, complication same, how to avoid, how to treat, almost the same. And here, prepare yourself, prepare the patient, prepare the equipment. Prepare the patient, it means the patient is lying flat and his ankle down the bed. Clear?
Over the edge, the bed. Yes.
Yes. Okay. So you will imagine line, circle line between the medial malleolus and the lateral malleolus.
lateral.
Easy? Okay.
Easy, sir.
Yes. So you have two deep nerves. Number one, deep peroneal in the middle, in the anterior surface of the dorsum of the foot, between two tendons, the
Extensor
extensor,
hallucis.
between the extensor and extensor, between what?
Extensor hallucis
and
longus and
digitorum.
extensor digitorum longus.
Yes, extensor hallucis means to the big toe, and the extensor digitorum, it means other digits. Okay, so finish this one. This one deep, it means you will inject one time or 2 times?
2 times.
It's 2 times.
Superficial and deep, right?
Okay, yes.
Superficial first, and then you will advance to go deep. You have posterior tibial, this one deep also. So you have 2 deep now, deep peroneal and posterior tibial. Clear?
Posterior tibial. Okay.
Okay. Then you will go for 3 superficial. Number 1, saphenous. Number 2, sural. Number 3, superficial. Okay. So the direction, very important. Deep peroneal, it means perpendicular. Done.
Okay.
Posterior tibial, posterior, it means posterior to medial malleolus, right?
Yes.
It will be behind the medial malleolus toward
The toe, the big toe.
big toe. Done. Finished. So others, it will be horizontal. So this one,
Okay.
this one perpendicular. This one, it will be towards the big toe from behind the medial malleolus towards the big toe. Saphenous, superficial, sural, it will be horizontal. Okay.
Towards the malleolus.
At the level of the malleolus, whatever medial or lateral. Okay. So saphenous, it will be from anterior to posterior. Superficial, it will be from anterior to posterior. Lateral malleolus, it will be from posterior to anterior. Okay.
Okay.
Or you can say behind to in front of medial malleolus. The lateral malleolus, sorry.
Okay.
Oh, easy.
Yes.
3 ml or 5 ml. 3 to 5, 3 to 5, 3 to 5, 3 to 5, 3 to 5. Maximum dose.
Okay. 3 milligram per kg.
Yes, because it's a lidocaine. Okay.
Yes.
You have 30 seconds and then 6 minutes.
Okay, can I start?
Yes.
Okay. Hello, I'm Dr. Yara, ED registrar. May I have your name and level, please? Nice to meet you. I heard you'd like to discuss about ankle nerve block with me. Is that true? Okay, so what do you know so far about that? Okay, is there anything specific you'd like to learn? Okay, so today I'll teach you about the indications, the contraindications, complications, how to prevent and treat them. Then I'll teach you about the procedure itself, preparing the equipment, the patient, and yourself, and then the post-procedural advice and documentation. So first, let's talk about the nerve block. We are blocking 5 nerves, 1 anteriorly, and then 2 at the medial malleolus site, around the medial malleolus, and then 2 around the lateral malleolus. What we're going to do is we're going to create an imaginary line from the medial malleolus to the lateral malleolus. So first, we'll start with the deep perineal. Where we inject is between the extensor hallucis longus and between the extensor hallucis longus and between the extensor digitorum longus. That's our first site of injection. And then we will move to the medial malleolus. In front of the medial malleolus, from anterior to posteriorly, we're going to inject the saphenous vein. Inject at the saphenous vein, the saphenous nerve, sorry, from anterior to posteriorly, horizontally. Posterior tibial is a deep nerve, so it's behind the medial malleolus. We have to be careful about injuring the posterior tibial artery. So we're going to direct our needle towards the big toe, from behind the medial malleolus, directed towards the big toe. And then on the lateral malleolus side, we're going to inject 2 nerves, superficial perineal and sural. Superficial perineal, we're going to inject horizontally from anterior to posterior, in front of the lateral malleolus, and sural is behind the lateral malleolus. We're going to inject from posterior to anterior. So now we know all our sites. What we're going to do is talk about the indications. So we're going to use this ankle block to numb the ankle and the foot of the patient for any intervention, such as suturing, removal of any foreign bodies, or draining an abscess. The contraindications are if the patient needs general anesthesia, if he refuses local anesthesia, or if he has allergy to the anesthesia. So any complications that we might expect are local anesthetic toxicity. Therefore, we have to ensure that the patient receives an appropriate amount. We have to accurately calculate the dose. And if he's at an extreme of age, if he's extremely young or old, we have to reduce the dose. And if the patient suffers from toxicity, then we have to move them to the resuscitation room, prepare interlipid, put the patient on oxygen monitors, and give him fluids. Other complications are vascular injury, especially with the posterior tibial. We have to worry about the artery, so we'll use ultrasound guidance, and we'll have a nerve stimulator to avoid nerve injury. Okay, now you know about the indications, contraindications, complications, and management. What we'll do is we'll head to the patient, we will clean and drape the area, we'll wear our PPE, and then as we mentioned, the sites, what we're going to do is first create our imaginary line. At the deep perineal site, we'll do superficial infiltration, which is at the dorsum of the foot, we'll do superficial infiltration first because this is a deep nerve. And then we're going to inject 5 millilidocaine perpendicularly between the extensor hallucis longus, as we said, and the extensor digitorum longus. And then we'll move to the medial malleolus. In front of the medial malleolus, we have the saphenous vein. So we will inject horizontally from anterior to posterior, looking towards our medial malleolus. And then the posterior tibial, again, this is a deep nerve. We will inject superficial infiltration first, and then 5 milliliter while pointing our needle towards the big toe. So let's move to the lateral malleolus. We will inject the superficial perineal horizontally from anterior to posterior, looking towards our lateral malleolus. And then lastly, we have the Schwirl. We will direct our needle horizontally again from posterior to anterior behind the lateral malleolus. Okay, now we've finished injecting our lidocaine. We're going to wait for 5 to 10 minutes to ensure that the patient that the patient's foot is numb, and then we will continually monitor the patient throughout to look for signs of toxicity. Is that all clear to you? Is there anything else you'd like me to explain? Okay, so after we're done with our local anesthesia, we have to document the amount we gave, the patient's vitals before and after, and then we have to tell the patient about if he experiences any tinnitus or if he experiences any metallic taste, dizziness, he has to report it immediately so he can be monitored for signs of a local anesthetic toxicity. We will dispose our PPE and dispose of our sharps. So is that all clear? Is there anything else you'd like to know? Okay. So I'll give you websites and
Thank
links.
you.
Okay.
Thank you. Okay, how many marks, guys, you will give Yara?
6 or 7.
Why?
9, sir. 9.
Why?
Not mention
10,
the
sir,
dose.
10.
Not mention the dose.
Not mention the dose, not organized.
Yes.
Organized was there. Organization was there.
So, did you mention the dose?
I don't think so.
No.
Okay. So, 3 to 5 ml each injection. Okay. So, you will inject 5 times, and the maximum safe dose, it will be 3 milligram per kilogram. But I think she mentioned in the beginning.
I think I did.
Yes,
I
sir,
wanted
she
to
was
explain
blind.
the sites
was
first.
blind.
Yes, sir, she mentioned.
She
Yes,
mentioned?
she mentioned in the
Sorry,
beginning.
Dr. Yara. Sorry.
Yeah,
I don't remember.
I think she mentioned in the beginning. Better to talk about the site when you will go to the point of during. You divide the
Okay.
session into 3 parts: before, during, and after, right?
Yes.
So in the beginning, no problem. You will just give idea ankle block, it means you will block 5 nerves. Okay, you will mention them, no problem. You will mention them, the name of the nerves. Okay, you will block deep peroneal. You will block 3 deep nerves and 3 superficial nerves, right?
Mm.
Start by this one in the beginning, no problem. Deep
Okay.
peroneal and posterior tibial nerve, and the 3 superficial nerves, saphenous and superficial peroneal and shura. Just like that.
Yes.
And then you will go for indication, contraindication, blah, 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 blah. Once you go inside during the procedure, you can say uh, you will prepare yourself, means wash your hands with PPE, and then prepare the patient. The patient will be lying flat, and his feet or his ankle, the affected one, will be away from the bed to reach it, and then you will
Mm.
prepare equipment, blah, 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 blah. Then you will go for the procedure. The procedure, you can start by deep peroneal, and then you can mention the landmarks and the direction. Easy
Yes, sir. Okay.
to be organized. Okay, so I will give you 9 marks.
Okay, thank you, sir.
Yeah, welcome. Next one, I think. Naveed?
Yes, sir. Assalamu alaikum.
Alaikum assalam.
Walaikum assalam.
So this one perpendicular. This one, it's up to you, 30 or even horizontal. Okay. Back abscess. So, Naveed,
Yes, boss.
you will inject around the abscess, okay? So it's very easy. The same approach before, in, during, and after. Zishan,
Yes, sir.
you will do the station of wound infiltration. It will be the same idea also, okay?
Okay. Yes.
So here's the indication to numb the area around the abscess to do incision and the drainage of the abscess. And the contraindication, allergic, allergic.
Allergy, refusal of the
Allergy,
patient.
If the patient need,
infection.
if the patient need, it's already infection. Don't mention infection.
Yeah. Yes,
Oh,
sir.
yes.
Already absent.
Yeah. Yes, sir.
Okay. So
Also, no need to mention ultrasound and nerve stimulator.
yes,
Oh,
no,
yes, yes, yes.
not applicable here. So here, if you will follow the general approach, take care. Sometimes it's not applicable. Okay. So you can say if the patient needs general anesthesia, for example, the patient already GCS 7, and you will intubate the patient. Why you will give local anesthesia? Already he will be intubated, for example, right? Okay.
Yes, sir.
Yes.
If the patient needs general anesthesia for any indication, and so on. More than enough 2 points. And I think it's a very easy station. So you will mark 2 points above 1 point above the abscess, 1 point below the abscess, and you will insert the needle in the first point, direct posteriorly, and then inject, withdraw the needle, inject, withdraw the needle. So you will infiltrate around the abscess by this way. So from this point posterior, and then from this point anterior, again above posterior, and then anterior. Easy?
Yes, sir. Inshallah.
Okay, so you have 30 seconds and 60 minutes. You can start.
I will knock the door. I will enter the room. I will. Good morning. My name is Dr. Naveed, one of the ED registrar today. May I know your name and level, please? Nice to meet you. I believe, sister, you have something to discuss with me today regarding the regional anesthesia block around the infiltration around the abscess. Am I right? Okay. It's a very important topic in the ER, and we are doing daily, and it's very interesting topic. So, how much do you know so far about this regional anesthesia block around the abscess? Okay, sister. Anything specific you want to learn? Okay. So let us to set our learning objective today for you. Today I will teach you the indication, the contraindication, the complication, how to avoid and how to treat the complication, and alternative of this procedure, and preparation for the procedure, during the procedure, how to prepare ourselves, how to prepare the equipment, how to prepare our patient, and the post-procedure management, post-procedure documentation, and advice to the patient and follow-up. Okay, sister, are you following me? Are you with me? Did you understand? So, and at the end, I will give you some good websites and videos to teach you more and more also. Every day I will teach you this topic. So please listen to me and follow me, and I will speak loudly for the purpose of teaching. Anytime you have any query, you can ask me. Feel free to ask me. Okay, sister. So let us first discuss about the indication of this procedure. If anywhere in the body there is any abscess, and we are doing to incision and drainage, so we are using this feed block. If there is any removal of foreign body, or there is any peronekia, any abscess in the finger, so in any wound suturing, so in this one we can use the regional anesthesia block. And the contraindication, if the patient refuses the procedure, or we take the patient, we take after taking the data ample history, and patient is high risk for this procedure, so we can go also under GA. And if patient have any allergy to the local anesthesia, and complication is maybe the local is systemic, or maybe local. The local may be local anesthetic toxicity, and systemic may be maybe the collapse, and maybe arrhythmia, maybe cardiac arrest. Okay. So how to prevent the complication? So we should use the accurate and amount, and accurate dose and amount of the local anesthesia, and we should decrease the dose in the extreme of the edges of the patient, and in the frail patient, or if patient have any other comorbidity. Okay, and in this procedure, let us to prepare first the equipment. What equipment we need during the procedure? We need local lidocaine, maximum dose 3 milligram per kg, and chlorhexidine, and 25 gauge needle, and dressing pack, and tegaderm. Okay. Be aware in this procedure, no need to ultrasound guided. Okay. This is important. Okay, so how to prepare ourselves? We will clean, wash our hand, wear PPE, we will wear sterile gown, and how to prepare the patient, and we will put a trap gas around the area and make a hole in the center, and clean with the chlorhexidine antiseptic solution, and we will make the landmark. The landmark will be the infiltrate around the abscess, which is the landmark. Okay, so first of all, let us we make an imaginary rectangle around the abscess, and we will inject at the 2 points, at the upper point, okay, and the lower point. Upper point above, lower point below of the abscess. Okay, so we will inject the needle. If for needle 3 centimeter, we will inject the needle 3 centimeter, and we will insert insert from the beginning of the abscess. Okay. So, for example, you will inject the whole length of the needle, 3 centimeter parallel to the abscess, and the whole length, 3 centimeter length of the needle will be inside the skin subcutaneous tissue. Okay. So first, we will insert the needle. After that, we will aspirate with no blood, so we can inject. Okay. So how we will inject? So we can the first the 3 centimeter inside the tissue, and we will withdraw the needle 1 centimeter. After that, we will inject 1 centimeter. Then again, we will withdraw 1 centimeter again needle, and after that, we will inject 1 centimeter. After that, 1 centimeter again withdraw the needle, and after that, we will inject the 1 centimeter. Okay, and be sure before any injection. First, we should aspirate to be sure it's not in the artery, not in the vein. Okay. So the same we will do for in the opposite direction from the downside to the interior and the posterior side. We will insert the whole length of the needle 3 centimeter. You will aspirate, then you will inject. Then you will again withdraw 1 centimeter, we will inject 1 centimeter. We will withdraw again 1 centimeter, we will inject again 1 centimeter. Okay, until we withdraw the whole length of the needle. Okay. So we will do this one both for in the upper and the lower point in the opposite side. Okay. So we will wait for 5 to 10 minutes to see the area for numbness. There is no pain, no.
Thank you. Thank you.
Okay.
How many marks, guys, you'll give Naveed?
Dr. Naveed performed very well, but he didn't finish his task.
So how many?
Yeah, Sarah, yeah, before I was rushing in the time. Today I try to control myself.
Yes, but you talk about injection like 5 minutes.
Yes. Technique 5 minutes. Yes.
CD.
You inserted the needle like 5 minutes. Okay. So how many marks, guys?
Just make me pass, sir. Okay.
9, sir.
Only pass, sir.
We are
Alhamdulillah,
inshallah all
happy.
pass. Under
Okay.
the supervision of Dr. Hani, we are all pass, inshallah.
Inshallah.
Don't
So
worry.
you did well, but you took long time in injection. So just mention 1 point above the abscess, 1 point below the abscess, and you can insert all the needle lengths, inject the lidocaine, then withdraw the needle. You can do until you finish all the lengths. You can direct the needle posteriorly and then repeat the same anteriorly. Above, you will do the same. Direct the needle posteriorly and then anteriorly. Done. Clear?
Yes, sir. Yes, sir. Clear, sir.
Okay.
Thank you.
So, welcome. After the procedure, you will observe the patient. You will dispose all equipment, the sharp needle and sharp pen, and the other equipment in the box. You will give the patient advice. You will give printed leaflet of, you will do drainage of the abscess, and you will give him printed leaflet, medication, and the charge. After that, you will document.
Sir, I also forgot the position of the patient. Sitting and prone position, I forgot.
It depends on the abscess. So the preparation of the patient depend on the abscess. For example, in the back, the patient will be better in sitting position or in prone position. Okay, like that.
Thank you.
Okay, well done. So I will give you 7 marks.
Thank you, sir. Thank you very much.
Next one, Zishan.
Yes, sir.
Also, you have another approach, and you can insert all the needle length inside the abscess in the midline. Okay, then you will inject 1 centimeter, withdraw the needle 1 centimeter, inject 1 centimeter, withdraw the needle 1 centimeter until you remove or until you withdraw all the needle. Then you will wait for 5 minutes, check the numbs around the abscess.
So my topic is the same also? The same?
No, no,
anemia
no.
of blood?
We will go for wound infiltration. They will give you this mannequin. I remember in my exam, I found the same mannequin like that. Okay, so here the same approach of teaching. How much do you know so far? Anything specific? I will set learning objectives for you. Today I will teach you how to do wound infiltration. Okay, so I will teach you the indication, blah, 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 blah. Okay, so I will focus now on the procedure itself. Clear? So the syringe and the needle 3 centimeter, and the syringe, for example, 5 centimeter, or the needle 3 and the syringe 3 ml, no problem, it's up to you. So you will insert half centimeter lateral to the edge. Clear? And you will start from the beginning of the wound. You will insert all the needle lengths. It will reach to the middle of the wound. Clear, Zishan?
Yes, sir. Clear.
Yes. Of course, you will mention regular aspiration, slow injection, and so on. So you will inject 1 centimeter. All the needle inside, right?
Yes.
Okay. So it will be like that, for example. I will give you the other one. Okay. Yes. So all the needle inside now. Okay. So you will inject 1 centimeter and then withdraw the needle. Inject 1 centimeter, then withdraw the needle. Inject 1 centimeter, then withdraw all the needle. Clear?
Yes, sir. Yeah. Thank you.
You will repeat.
You want,
You will,
okay, yes. I will repeat.
yes.
We will
Yes.
insert, okay, first of all, we'll take the 3 cc or the 5 cc syringe. We will insert the half centimeter lateral to the edge. We will start from the beginning of the wound, and then
So
we
you
will,
will divide the wound into 2 parts. Okay. So from the start to the middle, and then from the middle to the end of the wound. This one edge. You will repeat the same on the other edge. Okay.
okay,
It means 4 times.
okay,
Yes.
4
You have
times.
30 seconds, then 6 minutes. So of course, prepare the doctor, it means wash your hands, wear PPE, prepare the patient or the wound. So the patient will be supine and expose the wound. You will prepare equipment. You will mention all the points of equipment, and then the procedure. You will clean the wound from inside by normal saline, from outside by iodine, and you will start by lidocaine injection, as we mentioned. After you finish, you will wait for 5 minutes and
Yeah.
check numbness by forceps. You will hold the 2 edges in the middle and check numbness. Okay?
Okay, sir. Thank you.
Yes, you have 30 seconds and 6 minutes.
Thank you. Okay, Bismillah. My name is Dr. Zishan. I'm a registrar. May I confirm your name and the level, please? Okay, Mr. Peter. I believe you are here to learn the infiltration, the wound infiltration topic, right? Okay, so do you know so far about this topic before? Okay, no problem. You want anything specific to learn about it? Okay, well, that's good. Okay, so we will set the learning objectives. Is it okay with you? Right. So it will be, we will divide it into 3 gross categories: pre-procedure, during the procedure, and the post-procedure. So in the pre-procedure, there are 5 components. This indication, contraindication, complication, how to prevent complication, how to treat the complication. So we can start with the indication. As it is clear by the name that it is a wound infiltration, so we are infiltrating the analgesia, anesthesia, which is a local anesthesia, which is called the lidocaine. The indication is to numb that area, whatever the area. So it will be we are for suturing purpose, for the foreign body removal, for some other procedures. So the contraindication generally is an allergy with the local anesthesia, or there's sign of infection like cellulitis, or in case if the patient needs GA. Of course, you will take the history for the ample also, which includes which will give you this information as well. Complications includes any infection, any bleeding, or it may happen the local anesthesia toxicity, which is how do you know that? By the perioral numbness or the metallic taste, right? Okay, how to avoid the complication? By the educate and the accurate dose of the local anesthesia. And you have to make sure that be cautious for the extreme of ages for giving the dose. So I think it is better to keep it at the lower dose. Start with the lower dose. Okay, how it will help you by the ultrasound guided also to prevent the complication as well, and also infiltrate slowly and with the regular aspiration. And of course, the last thing, to keep the bedside intralipid with you, so that in case if you get the toxicity complication, you can treat them. How to treat the complication? Suppose it will develop, as I said, keep the intralipid, give the intralipid 20% immediately in case if you have the sign and symptoms, and move the patient to the monitor, check the oxygen, IV fluid, do the ABCD approach. Okay, this is how we finish the pre-procedure technique. During the procedure, there are two gross features. One is the preparation, one is the procedure. This is preparation for the equipment, for the patient, and for you. For you, you have to wash your hand and wear PPE. For the patient is the position mainly. And then for the equipment, you have all the equipment for the infiltration like lidocaine, syringe, 3 cc or 5 cc, antiseptic, iodine, drape, and the instruments, and as well as antidote. Okay, for the procedure, you have to take the consent first, and then you have to consider the comfortable position for the patient as well as for you. Then you will clean and drape that area with the iodine. You will cover that area, whole area except the area for the wound where you are going to do this procedure, local infiltration. And you have to have the landmark. And then you will infiltrate the local anesthesia, lidocaine 3 milligram per kg. What? Can you repeat it? 3 milligram per kg lidocaine, and which is the safe dose. And you have to insert 3 to 5 ml. Wait for 5 minutes. Use the forceps to check the numbness before you proceed. Okay, we finished during the procedure. Now the post-procedure technique. What do you do post-procedure? First of all, you have to dispose all the sharp equipment and the rest of your PP, everything. Ask about the tetanus immunization, if he has taken or not. If not, then you have to give the tetanus as well. Check the vital signs, patient assessment. Post-procedure advice and the follow-up. You will instruct the patient if there is any sign of infection, any pain, bleeding. You will come back to the ER. Keep it dry, that area, for the next 48 hours. Give the leaflet for the instruction, just how to take care of his wound. And finally, the documentation, whatever you have done, please document it carefully. Did you get it? And the last but not the least, you have I will give you some websites and the leaflet. And if you can read it, and if you need my help in future as well, please come to me. I will help you as in the real procedure as well. Okay, is it okay with you? That's fine. Okay, I would like to recap also. If you want to know anything, okay, that's fine. I would like to recap the indication, the contraindication, and the complication, which is important. Can you please repeat for me? Okay, did you remember anything? Yes, that's wonderful. You know, you are aware about everything. Mashallah, you're very smart. I'm glad that you learned a lot in this time. Thank you very much.
Okay, what do you think, guys? How many marks you will give physician?
Only 5.
Why?
Because he talked too much each and every aspect, but didn't talk about the procedure. 1 centimeter away from the edge, from the start to the middle, then from the other edge, and the 4 times we have to inject, and first insert, aspirate, and then withdraw.
Yeah, oh my God. Yes, I forgot.
Yes, 4 procedures you forget.
He was thinking about suturing.
Yes.
like the last
Yes.
decision again.
Yes, sir.
He is thinking about suturing. So
Yeah, you're right.
Yesterday also thinking suturing.
okay. So he's doing well, but focus on wound infiltration. Your task is wound infiltration, not suturing. Clear, Zishan?
You're right, absolutely right. Thank you.
Yes. So care about infiltration. They will get marks for this point. Okay. So you will insert all the needle lengths from the beginning of the wound to the half of the wound. You will insert 3 centimeter. You will inject slowly. Withdraw the needle 1 centimeter. Inject 1 centimeter of lidocaine and withdraw the needle 1 centimeter, and so on. So you will repeat that 4 times. So from the beginning to the middle, then from middle to the end, then you will repeat the same on the lateral other edge. Okay, so how many marks, guys?
It is upon on your mercy, sir.
Okay, I will give him 7 marks. So you should prepare also lidocaine, intralipids. Okay, very important. So if you mention the indication, contraindication, complication, how to avoid, how to treat, very important here because it's wound infiltration, means local anesthesia. Okay, well done. So after injection, you will wait for 5 minutes. Use forceps to check numbness in the wound, and then you will do suturing because wound infiltration means for suturing. Then after that, you will discharge the patient, give printed leaflet, and dispose all equipment, sharp needle and sharp pen, and other equipment in your box. You will document the procedure. Okay, next one, Muhammad Imran.
Yes, sir.
Okay. You have another technique, vertical. Vertical here, it means you will divide the wound into centimeters. You will inject vertically in each centimeter. Okay. You will inject from the edge of the wound, then vertically 1 centimeter. So you will start from the beginning of the wound like that. Then like after 1 centimeter and so on. You will inject in both sides, but I don't like this approach. Okay. Regarding teaching ECG and ABG, we can take break, guys, like 15 minutes.
Yes, Rahman.
Yes, sir.
Of course, sir.
Sure.
Yes,
Sure, sir.
15 minutes break, and then we will start ECG and ABG teaching. Okay?
Okay.
Yes.